Hi, Dr. Welcome to Wanja's Health Diary.
Thank you.
Given the events of the last couple of days about the attack at Riverside, 14 Riverside Drive, as a child psychiatrist, what are some of the triggers of trauma in children?
Yeah. Oh, thanks. Some of the commonest triggers that I've come across, like family conflicts, which are related to when parents are fighting, or there's a lot of violence within the family, and physical or verbal violence.
Yeah.
Then things like sexual abuse and also physical abuse, especially with regards to punishment, severe punishment of children, which is almost tantamount to physical abuse. Then things like these natural disasters. We've seen landslide in sometime in Moranga when there's a lot of rain, and also terrorism like what we saw the other day, and also attacks by thugs when children are there and they're seeing their parents being dragged into different places or being harmed by the thugs. So those are some of the commonest that we have seen.
As a parent, as a teacher, as a guardian, what are some of the signs and symptoms that that are apparent that a child has undergone trauma?
Some of the symptoms include what we call separation anxiety, a new separation anxiety. And what are these symptoms of new separation anxiety? The child becomes clingy, the child becomes irritable, crying all the time, more so when parents are leaving the house, or the child feels that the parents are the child is going to be left alone, or sleeping with the lights on, whereas previously the child was able to sleep with the lights off. So that is a new separation anxiety, and needs to find out why, and it's related to the event that had happened. Other things is lack of sleep, very bad dreams, or what you call night terrors, and then inability, and then playing out the event that had happened, and or just withdrawing into playing by himself or herself, and not wanting to play with other children.
At what point do you intervene, and what are some of the possible ways of dealing with this kind of issues?
Let me say that at the point when you pick the problem, then you intervene. But when a child who has been sleeping well starts missing sleep or starts getting scared of going to sleep, then you need to find out why. Two, when a child becomes clingy, you need to find out why. But basically what you need to do, the parents or the caregiver of the child needs to be prepared. And once the caregiver is prepared, it helps the child to overcome the problem.
So when a child is brought to you, what are some of the therapies or forms of treatment to deal with effects of trauma?
First of all, after talking with the adult who has brought the child, I talk to the child and I ask the child, we can play with the child using toys, so that I see whether the child is playing out the trauma, or we do some drawing with the child and writing. And I've seen in some occasions that the child repeatedly draws the same thing, so they get preoccupied with the same thing, and that tells me that the child is now re-experiencing the trauma, and it reaches a point where the child now becomes scared and seeks for some consolation from the caregiver. Yes.
And in terms of the support, maybe you could take us through in terms of a treatment plan, whether it's medical or non-medical, with drugs or without, and how the members of a family and a community can help this child get back to a normal life.
Okay, let me talk about non-medical, which even our grandparents used, whereby the family members are brought to an equal understanding that this child is going through some trauma, and so they need to be able to help the child at their lowest level when they are scared, to help them, to reassure them. In fact, one of the best things is to reassure the child that you are safe and it is not going to happen as long as we take care of each other. Then 2, help the child to go and sleep without feeling that being scared, by going to sleep with the child for a while and then put the lights off. Then reassure the child that I'll be leaving and I'll come back, that you will be safe. And eventually, then now we use the medication to help the child. If they are not sleeping or they are too irritable, then we give. But as I said, rarely do we give medication.
Yeah.
Once the adult is prepared, they are also not scared, because some parents are so scared. They are so anxious that they even transfer their anxiety to the child. So when you treat that adult, you basically treat the child.
Okay. Yes. And finally, in terms of, are there aspects where you have adults who had issues when they were children and they haven't been able to deal with it? And what happens when they're already in an actual adulthood stage and they need to deal with stuff that happened, a decade or 2 or 3 when they were young?
Yeah, sometimes you have adults who have had traumatic experiences that were never dealt with, and when they have their own children who have experienced the same, they also re-experience. In fact, it wakens up their own experience, and what happens? They become overly protective of their children, and that can tell you that maybe you need to separate and now address the issue of the adult before addressing the child.
Yeah.
Yes.
And finally, in terms of exposing children to traumatic events, do we do it as adults by proxy, and how can we prevent that?
Yes, that happens a lot, of course, unknowingly.
Yeah.
When you talk about, let's say you are watching in the papers, and then you make noises like, wow, oh my God, this was so scary. Now the child is observing you, and when the child looks at it, will also react the same way. Or when you're watching TV and you react, then they are also going to react in the same way, and they start getting scared. So actually they get it by proxy.
Yeah.
Yes.
So what should we do?
I think, okay, I'm not saying that we need to be too careful,
yeah,
but it is good to address the problem, to understand that children also get traumatized, so that when we are near them, we are also able to observe some precautions so that we don't transfer it to them.
Okay.
Yes.
Thank you.